In the 25 years that I've been with Riverside, I've seen Riverside deliver rehabilitation services to many patients for many reasons in many settings. For example, every year 350,000 people elect to have hip replacements. 500,000 people elect to have knee replacements. 450,000 people unexpectedly have hip fractures or pelvic fractures, and only a small percentage of those return back to the activity levels they enjoyed before their fall. 800,000 people have a stroke every year. That's every 40 seconds somebody has a stroke. 1/3 of those are left with long-term disability. There are several different settings in which a patient could receive physical rehabilitation. After a doctor's visit, the doctor may recommend an independent home-based program, giving the patient some instructions on how they could do their own routine to improve their balance, to improve their abilities to stay at home. The physician may order home health therapy to go into the home, to provide training, exercises, and maybe some adjustments to the home setting to allow someone to stay at home who might otherwise not be able to. On the other hand, an individual might be eligible for an outpatient-based program. They might go to one of Riverside's wellness centers and participate in an independent or guided program within that facility. They may also require more skilled services, and a physician may order physical therapy, occupational therapy, speech therapy, respiratory therapy, any one of a number of therapies to help try and keep the person more independent and more able to stay at home and more able to perform the activities they need to and want to perform. Unfortunately, there are those that have more serious needs, and their needs may need to be met in an inpatient setting. For example, the Riverside Rehabilitation Institute is the only licensed acute care rehabilitation facility in the area. Patients may go there who have more significant rehabilitation and medical needs. There are numerous opportunities for improvement to allow someone to stay at home who might not be able to stay at home otherwise, and much of this involves rehabilitation. It could be something as simple as teaching the person to use a cane properly. I mentioned that there are 450 hip and pelvic fractures each year, 50,000 of those as a result of improper use of a cane or a walker. Something very simple, but something very avoidable if the person could be taught to do that properly. Strengthening muscles, improving your balance skills. Once again, relatively simple activities, but they lessen the chance of a fall. Those who have falls and break a hip, unfortunately, 15 to 30% don't even survive the first year. Of those that do survive, the majority don't get back to the level of independence that they enjoyed before their fall. As anyone who's been working in healthcare knows, over the years we've seen a ratcheting down of reimbursement for different services. Services that were once done on an inpatient basis are now done on an outpatient basis. Rehabilitation is no exception to that. At the Riverside Rehabilitation Institute, 10 years ago, patients with hip fractures and knee fractures came there routinely. Now, most payers will not cover that, hence the development of the Riverside Rehabilitation Centers on the campus of the convalescent centers, where most insurers still do cover that. But who knows, perhaps in the future, it'll be expected that patients will go straight home from the hospital after knee replacement and either do outpatient therapy or home therapy. Fortunately, Riverside has all the components to deal with whatever comes our way in terms of where rehabilitation will need to be delivered. What is also fortunate is Riverside has the tools to track the outcomes of rehabilitation in these different settings. Whether it be home therapy, outpatient therapy, or inpatient therapy, Riverside has software tools and programs in place to be able to demonstrate the progress made by these patients who are coming in for inpatient rehabilitation. We can provide that information to the physicians who have referred them to us. We can, of course, let the patients see the progress that they've made. And equally importantly, we can show the payers that they're getting their money's worth, that Riverside is giving them the rehabilitation they expect their patients to receive. So whatever the future has in store for Riverside, Riverside has the tools to deal with it, and I'm glad to be a part of that.